Welcome to Module 3 in Dental Office Emergencies. This week we will cover Chapters 3, 4, and 5. The following videos will review vital signs and syncope. The discussion question for the week will be presented at the end of the videos. You may find the video created at the dental school quite interesting.
Exercise is the vital signs, which involves the blood pressure, the pulse, and the respiration. I'm going to show you a blood pressure cuff that we have available to all students for children and for any individual who has a large arm. You have a blood pressure cuff that is an adult size, and this is what we're going to use for most average sized individuals. We have a large cuff, and if we compare it, it's quite a bit smaller than the large cuff, and then we have a pedo cuff, and this is even smaller than the adult size. You're going to use the size cuff according to the size of the arm that the patient presents you. Once you have brought your patient back to the chair, you're going to have them in the chair, and we're going to start off by showing you the procedure to take the pulse. And with the pulse, you're going to have the patient resting comfortably, and you're going to have them just rest their arm on their armrest and have their arm the palm side up. You're going to take your index finger, your middle finger, and potentially your ring finger, and you're going to place all three fingers trying to feel and locate a pulse. Once you have begun to feel the pulse that the patient has, you're then going to begin to start counting the numbers of pulse that you feel, making sure you don't use your thumb when you're counting that pulse, and you're going to then begin to count the pulse. Look up at the clock that's provided for you in the room, and you're going to count that for 30 seconds. After you have counted that for 30 seconds, how many pulse beats that this person has, you're paying attention to how it feels in your fingers. After the 30 seconds, you're going to conclude with getting an idea exactly how many pulse beats that this patient has. After the 30 seconds is up, I'm going to multiply it by 2. In this case, this patient has 33 that I've counted. I'm going to multiply that by 2 to get 66 as the pulse rate. The next thing I'm going to continue to do is keep my fingers in the place that I had to collect the pulse, to then begin to look at the number of respirations, and that's the number of times that the chest will rise and fall. Once the patient has continued to do that, I'm going to just continue to look up at the clock on an occasion, not to make it apparent that I'm staring at the patient's chest. You're going to count the number that it rises for 30 seconds, and then you're going to multiply that number. Once you have done that, you're going to enter both the pulse and the respiration into the clinical exam tab. If it's for a recall patient and they're coming back for a second visit, or a new patient for more than one visit, you're going to record that information in the treatment notes. To take the blood pressure, you're going to keep that patient in the same position, making sure here for sure that the patient has kept their legs uncrossed. Sometimes you mention that to the patient, and as soon as you turn around, they go ahead and recross their legs, because it's a common thing that they do. If they do cross their legs, all you need to do is to tell the patient, please can you uncross your legs, it will affect the blood pressure. The next thing you're going to do is take your blood pressure cuff, and I'm going to explain what we're going to be looking for. We have the cuff that has identified a left and a right arm arrow. If you're taking the blood pressure on the patient's right side, then you want to make sure that you line up this red arrow to the area located in the antecubital area. We're looking for the brachial artery. And you can palpate it to see whether you feel any kind of a pulse. You're going to place your blood pressure cuff, this is the crease in the elbow, exactly about 1 inch above that crease in your elbow. The nanometer is a meter that has numbers from 0 to 300. It goes in 2 millimeter increments, and we're going to watch how that nanometer, the dial or the needle, actually moves as we are taking the blood pressure. The first thing I'm going to do is take the nanometer and place it on the gray satchel that's there, so that the nanometer doesn't fall to the ground. It's a little bit heavier, so it does cause that blood pressure to somewhat sag. What's important next is that I'm going to make sure I have the right blood pressure cuff, and if I don't, I have the opportunity to go get the large cuff, or I can get the pedo according to the patient's size. The next I'm going to do is I'm going to place the blood pressure cuff directly above 1 inch for the line that I identified for the antecubital area, making sure that no clothing gets in the way, and you're going to place it directly where you felt the pulse, and you're going to hold it snugly and place it on the patient's arm. Once you have done that, you have a blood pressure cuff that has a bulb. This bulb also has a dial. This dial is, you're going to go righty-tighty to tighten it so that when you start to push the bulb, it will allow the needle to inflate the cuff, and when you want to deflate the cuff, you're going to go lefty-loosey. And when you do lefty-loosey, you're just turning it ever so slightly so that the needle doesn't deflate so quickly that you're not able to get a reading. So first, once you have the cuff on securely, the next step is to identify the maximum inflation level. That's going to require you to place again your fingers, either your middle finger, your index finger, and your ring finger, back on the area to feel for the pulse. I'm going to make sure that the knob is tightened on the bulb, and I'm going to have righty-tighty, and then I'm going to begin to inflate the cuff by depressing the bulb and feeling for the pulse. When I'm no longer able to feel for the pulse, then I'm going to stop, lefty-loosey, and deflate the air. I'm going to begin by pumping it up, and you're going to watch now the dial as I pump to show you exactly what it's intended to do. As you can see, it continues to rise. I'm feeling for the pulse. I've no longer felt the pulse. I'm going to stop, lefty-loosey, loosen it all the way out, and then I'm going to wait a few seconds, maybe about 15 to 30 seconds, before I re-inflate that. That's going to tell me what I have when I no longer felt the pulse. I no longer felt the pulse at 80, so I'm going to add 30 to that. I'm going to add 80 and 30 is 110. That means I'm going to have to inflate the bulb all the way up to 110 before I actually start releasing the bulb to get a number for the systolic over the diastolic. The systolic is the top number. You'll begin to hear that with a very large beat. It may go through a court cough kind of a sound down to the diastolic, and that's when I no longer hear the heartbeat in my stethoscope. Your stethoscope you're going to have around your neck, and what you're going to do is that it has earpieces that you need to place in and downward in your ears. Sometimes it's a little tight when you first begin to use it because you have a brand new blood pressure cuff. So I'm going to actually put that in my ears, and I'm going to take the stethoscope, and there's going to be a flat part, and this flat part has to rest evenly on the arm. I'm going to place that here, making sure that it's slightly underneath the blood pressure cuff, supporting the elbow, and placing my tongue, actually my thumb, on the area without preventing that stethoscope from rotating on the arm, therefore getting an incorrect blood pressure reading. Once I have stabilized that, I'm going to make sure that the elbow is straight. I'm securing it, trying to keep it without making too much noise, because otherwise that's transmitted through the stethoscope into your earpieces and can be quite large. It's also important that you instruct your patient not to talk to you prior to doing the blood pressure, because as they talk to you, you can no longer hear the heartbeat. Again, what you're going to do is turn the knob on the bulb righty-tighty so that I'm getting ready for me to be able to inflate the cuff, remembering that I had found that pulse beat at about 80, so I'm going to pump it up to 110. What's important is when I do lefty-loosey, starting at about 110, that I'm going to release it at 2 millimeters of mercury at a pace that I can hear the systolic over the diastolic. I'm going to start by blowing and inflating, not blowing, the blood pressure cuff. And continue. It gets real tight around the patient's arm to about 110. Start to do lefty-loosey. I just began to hear the heartbeat. She has nice court cough sounds. I'm going to continue until I no longer hear it. And you'll let it go. Then I'm going to report that blood pressure reading to the patient, and I got about 104, because it has to be an even number, over about 58. Again, that has to be recorded in an even number. That's listed in the tab under the clinical tab, under other tab, and then the patient notes. So there's two places that the blood pressure are going to be recorded. And that concludes the demonstration of the vital signs of the blood pressure, pulse, and respiration.
All we're going to do today is take this 27 gauge needle and stick it really deep inside your face.
Oh, I don't know about that.
So here we go.
Oh, I don't know about
It only hurts a little bit for a little while.
I'm not feeling
Are you doing
so
okay?
good.
What's going on?
I'm feeling a little warm.
This needle's not that big.
I'm feeling a little warm. I'm not feeling so good.
Oh God. Oh my gosh, I think oh God. Oh my gosh, I think she's fainted. It's called syncope. We're gonna put her in the Trendelenburg position, which no one really knows what that means, but put her head down so the blood goes to her head.
Oh my gosh, that woman looks anxious, white, she's sweating, warm, nauseous, faint, and dizzy.
Ma'am, are you okay?
Oh, I'm okay. I'm fine.
Here,
I'm
I'll have
fine.
you breathe a little bit of this.
I'm fine.
Take some deep breaths.
This is so embarrassing.
It's okay, this happens to everybody. I'm pretty sexy.
I'm feeling better.
All right, you doing better now?
Man, yeah.
Okay.
This just happens sometimes. I'm feeling better. My doctor saved me.
Dr. O'Donnell, Amy's waiting in the waiting room. She seems kind of nervous. Can we go ahead and bring her in?
Yes, please.
Okay. Here's Amy.
Hi, Amy.
Hi.
Go ahead and sit down for me. I'm looking a little bit pale.
Yeah, I'm like really nervous. Do you have like a pill or something to give me to calm my nerves?
Well, let's just not take pills quite yet. Let me go ahead and get your vital signs. You are having a root canal today, yes? You are sweating, okay?
Yeah, I'm feeling really hot right now.
All right. Well, why don't you go ahead and take some deep breaths for me? All right, let me go ahead and check your blood pressure. This is going to let us know how your body is reacting right now. Go ahead and put your arm out for me. Great. More deep breaths for me. This is going to be a simple root canal today, Amy, okay? I want you to stay calm. Okay, your blood pressure is running a little bit high. It's 145 over 95. That's certainly a little bit higher than we would like. Let me go ahead and monitor your heart rate. Stick your hand out for me like this. Yes, your heart rate is at 100. Okay, so once again, I'm going to need you to take some deep breaths in and out, okay? Everything's going to be fine.
Okay, doctor, here's your instruments for today. I feel really dizzy.
You're going to be just fine. Don't... Amy. I need help in here. Help me put her in a Trendelenburg position. Get the oxygen mask. All right, go ahead. Desiree, please come monitor the vital signs. All right. I'm going to take her pulse. She's experiencing vasovagal syncope. Let's take the blood back to her head. 100% oxygen. Pulse is down to 85. Blood pressure. And her respirations are at 15. Continue to monitor oxygen. And her blood pressure, it's now at 125 over 80. Okay. And she's waking up. Okay. Okay, Amy, let's go ahead and sit her up. Go ahead and keep the blood pressure cuff on so we can continue to monitor her vital signs.
What happened?
Okay, Amy, you just had an episode of what we call vasovagal syncope. What this means is that you fainted. Okay, I believe this is due to the fact that you were very anxious before your appointment. Okay, we're going to go ahead and terminate the procedure. We're not going to do the root canal today. All right. I think that your high blood pressure, those readings that we took were very high before we began. Okay, so in order to deal with this, we're going to have you come back, and I'm going to prescribe you an anti-anxiety pill. This is going to help relax your nerves and keep your blood pressure, your heart rate down, okay, to safe levels so that we can do the root canal and get you the treatment that you need.
Okay.
All right, we're going to continue. We're going to keep you here for a little bit longer. Just check those vital signs again, and then you'll be released.
Okay.
Please address the following for your discussion posting this week. You have noticed your patient has lost consciousness immediately following the taking of vitals. What will your first course of action be? Who will you notify? Please post your initial posting by Wednesday midnight and complete a response to one of your peers by Sunday midnight. This concludes the course lecture for the week.